Today, we're diving into something that's, well, it's just plain confusing and painful for so many people. We're talking about that lingering pain from shingles, a condition called Post-Herpetic Neuralgia. This is the big question, isn't it? You've gone through the horrible shingles rash, you've waited for it to heal, the skin looks fine, but for weeks, months, or sometimes even years later, the pain just won't go away. It's incredibly frustrating, and today, we're going to break down exactly why that happens. So let's picture this, okay? Let's make it real. Imagine a 75-year-old woman. She had shingles about 6 months ago. The rash itself, totally gone, but the pain, it's still there. It's a constant, deep, burning feeling, so sensitive that even a light breeze on her skin is agonizing. This isn't just some hypothetical story. It's the tough reality for a lot of folks. To really get why this pain sticks around, we've got to go back, way back to the very beginning, to the virus that kicks this whole thing off. The culprit here is a mouthful, the Varicella-Zoster Virus, or VZV. Now, if you've ever had chickenpox, guess what? This little guy is still hanging out inside your body. It doesn't actually leave. It just retreats into your nerve cells and lies there totally quiet and dormant for years and years. But then, for different reasons, maybe you're getting older or your immune system is just a bit down, this virus can suddenly just wake up. When it reactivates, it travels down the length of a nerve fiber all the way to your skin. And that's what causes that classic, painful, blistering shingles rash that shows up in a stripe on one side of your body. And listen, this isn't some rare thing. The odds of getting shingles in your lifetime are about 1 in 3. That's a huge number. Considering almost every adult has had chickenpox, this is something that can affect pretty much any of us. But here's the thing. That rash you see, that's just the tip of the iceberg. The real problem, the lasting damage, is happening where you can't see it at all. And this is maybe the most important thing to understand. Shingles is not just a skin problem. At its core, it's a neurological disease. It is a full-on attack on the very nerve the virus travels down. The rash is really just the evidence on the outside of what's happening on the inside. Okay, so think about it like this. A healthy nerve is like a perfectly insulated electrical wire. It sends clear, crisp signals to your brain, no problem. But when shingles comes in, the virus attacks that nerve and damages it. It's like it chews up the insulation, leaving you with a frayed, damaged wire that starts to short circuit and send all sorts of chaotic, false pain signals. And what does that pain actually feel like? Well, people describe it as this deep, non-stop burning or aching. On top of that, you can get these sudden stabbing or shooting pains, almost like little electric shocks. And for many, the worst part is something called allodynia. That's when things that shouldn't hurt at all, like the touch of your clothes or a bed sheet, cause excruciating pain. So this whole condition, this chronic pain from those frayed wires that just keeps going long after the rash is gone, it actually has a medical name. It's called Post-Herpetic Neuralgia, or PHN for short. Clinically, it's defined as pain that lasts for 3 months or more after the shingles first appeared. So who's at risk for this? Well, the answer is pretty clear. It all comes down to age. The older you are when you get shingles, the higher your risk. And it's not a small jump, it's skyrockets. For someone in their 60s, the risk of developing this chronic pain is about 60%. Get shingles in your 70s, and that risk jumps to a massive 75%. And this really is the key takeaway from a clinical standpoint. The #1 risk factor more than anything else is age. That is why the entire medical strategy has shifted. For any patient over 50, the main goal now is prevention, to stop shingles from ever even starting in the first place. Okay, so that's the problem. But what if you're already dealing with this awful pain? What can actually be done to calm down those misfiring nerves? Let's look at the toolbox. Well, there's no single magic bullet, unfortunately. So doctors use what we call a multimodal approach, basically a whole toolbox of different treatments. This can be anything from topical things you put on your skin like a lidocaine patch to oral medications specifically designed for nerve pain like gabapentin. And for really severe cases, there are even more advanced options like nerve blocks. And here's a really critical piece of evidence-based advice from the research. Time is everything. If you think you have shingles, getting to a doctor right away is vital. Starting antiviral medicine within the first 72 hours of the rash showing up can seriously reduce your chances of developing this long-term nerve pain. But all this talk about treatment brings us to the most important point of all, the number one absolute best strategy when it comes to PHN. You know, the single best way to deal with post-herpetic neuralgia is to make sure you never have to deal with it at all. Prevention is everything. And how do we do that? It's pretty straightforward. Vaccination. The modern shingles vaccine is incredibly effective, and studies show it can slash your risk of developing this awful long-term pain by about 67%. That is an absolute game changer. So if there is just one thing you take away from all of this today, let it be this. If you are over the age of 50, please talk to your doctor or pharmacist about the shingles vaccine. It is, hands down, the best tool we have to prevent shingles and its most feared complication, post-herpetic neuralgia. All right, let's wrap this up with a quick review. Here are the most important things to remember from our deep dive today. First, shingles isn't about your skin, it's about your nerves. It's a nerve attack. Second, that awful lingering pain, PHN, comes from those damaged, frayed nerves sending out bad signals. Third, as we get older, our risk of getting this just goes way, way up. And finally, your best shot at avoiding all of this is prevention, and that means vaccination. So we'll leave you with this thought. Now that you know the why behind this pain, it's not some mystery anymore, right? It's something you can actually do something about. So what's one step you can take, starting today, to protect yourself or someone you care about? Thanks for joining us.